If you're looking for a good hair transplant surgeon, you have to look at their results first. You have to look at the reviews. You have to look at their credentials, education, fellowship training. You want a physician to be surgeon or plastic surgeon, dermatologist who had fellowship training, special training to be a hair transplant surgeon, not just a few workshops. Obviously, word of mouth, talking to people, get recommendation from other people who had a hair transplant before. Those are important. How do you prepare for hair consultation? If you're seeing a hair transplant surgeon for your hair consultation, you need to be, first of all, ready with your questions, about medications, procedure, and everything that you need, and also make sure that you're not wearing any products on your hair. Keep your hair at the length that you always want to keep it, because the doctor look at the length of the hair, and based on that gives you a recommendation of where you have to put hair. No products, no concealers, no topic, none of those. Just be yourself. People ask what vitamins to use for hair. You need vitamins for growth of the hair, but usually with a natural balanced diet, you have enough vitamins. You don't have to get extra vitamins. Nothing is needed to grow your hair better. There's some vitamins over the counter for growth of hair on the label, but it does not necessarily help your hair, especially if you have pattern hair loss. Does high protein diet help your hair? It does not. You need protein to grow your hair better, but we have enough protein. As long as you're not malnourished, you don't need extra protein to grow your hair.